Okay, we're going to go ahead and get started. Welcome, everyone. I am Justine Roberts. I work for the Center for Ethics and Social Responsibility at the Leeds School of Business, and it is my great pleasure to welcome you today to the first of our three-part series on the workplace and current events. There are two more sessions, one next Thursday and then again the following week, both of those at 2 p.m. And more information on those topics, the speakers, and how to register can be found on the CSER website. I will also email a link out at the end of this session. Our three incredible speakers today, Russell Cropanzano, Esther Horowitz, and Andrea Miller, will all introduce themselves to you in just a minute. I'm going to start with a couple of housekeeping items. The first is please keep yourself on mute throughout the panel. We do recommend using speaker view or presenter view. And the session is 60 minutes long. We'll spend about the first 40 minutes or so on questions that have been prepared in advance, and then open it up to the audience. If you do have a question, please put it in the chat and I will read them out at the end. Before we begin, I would like to recognize that our program today is located on the traditional territories of the Arapaho, Cheyenne, and Ute peoples. In addition, 48 contemporary tribal nations are historically tied to the lands that make up the state of Colorado. And lastly, a note on today's topic. When we first began planning this series, we were coping with the pandemic and we were thinking about how the workplace was adapting in times of crisis. Since then, there have been also other really significant national conversations that have emerged, most importantly around racial justice and social justice, and we need to be discussing those as well. So today's panel will be broader than just COVID. And with that, I would like to ask our panelists to introduce themselves.
I primarily study emotion in the workplace. I'm usually interested in things like well-being, though in the past few years I've been collecting data on anxiety and depression at work, how people cope with traumatic events, how they cope with economic changes such as the gig economy. And I guess I'm a natural for this because I also look at crises, organizational crises, and how that affects worker adjustment.
That's so interesting, Russell. I didn't know that. Awesome. Well, my name is Esther Horowitz. I am the bilingual counselor at the Faculty and Staff Assistance Program at CU Boulder. When I say bilingual, I speak Spanish and English. I'm originally from Ecuador, and I've been at CU for almost 2 years now. And well, my work is tied to this discussion because we work with staff and faculty, and it's so important to be able to have this service available. It's free, it's confidential, and even if you don't want to see us because we're part of the university, we do have a referral list of folks in the community that work with our insurance or don't work with our insurance, but also have a sliding scale for our staff and faculty. So thank you.
Thank you, Esther. Hi, my name is Andrea Miller. I am the Corporate Social Responsibility Manager for Delta Dental of Colorado. We're a team of about 205 employees based here in the Denver area, and we've all been working from home, even our call center. We were quick to scramble to get everyone working from home, which has been a big adjustment for our team. I'm a proud graduate of the CSR certificate program, a 2018 graduate. Which helped me learn a lot about some of these things we're going to talk about today. My work's been spent primarily in the nonprofit field for the last 20 years in fundraising, organizational development, event planning, policy, and advocacy. And I have a master's from University of North Texas in public administration, particularly nonprofit management, where I did spend a lot of time talking about efficiency and structure in the nonprofit field. So I'm glad to be here.
Thank you all. So I want to jump in with the first question for Russell to start. And that is, what do you think we should, from your background, as employers and colleagues, be expecting now? We're about 4.5 months into the pandemic, and in light of the movement for racial justice and looking ahead to an uncertain fall, potentially spring, filled with complexity, what would you be telling companies to be watching and planning for?
About the pandemic or about racial justice?
Well, I think from the perspective of employees' mental health. So there's a lot of uncertainty in the world. There's a lot of anxiety. There are a lot of strong feelings, concerns of safety, personal safety, safety of our colleagues.
Okay. Let me do the pandemic first, and we can go from there, because it's kind of an unusual sort of organizational event, which I guess everyone's figured out by now. And I'll tell you why it's unusual. If you think of a typical crisis, you're thinking of something like a bankruptcy or massive downsizing. Now, they're not necessarily a one-term event, but it's pretty circumscribed. The interesting thing about COVID-19, though, is it rolls over a number of months, and you've got to deal with the effect of the virus itself and people's fear of getting sick or their family getting sick, and so on. Then you've got to deal with this sort of series of secondary consequences. So let me give you an example of them. Right off the bat, elder care. Right? A lot of people my age, a little bit younger, they're in the so-called sandwich generation. So they're taking care of their elderly parents as well as their own children. And parents, if they're older, they're very, very high risk. They could die. Let me give you another one that you might not have thought of. Intimate partner abuse. In a number of places in the world, including, unfortunately, in the United States, when people are home, they sometimes fight. Arguing is often okay if it's done in a constructive way, but not in an abusive or violent way, of course. And we've seen higher rates of that. And then there's the lingering effects of unemployment that people don't know about. I think our administration here at CU has done an excellent job. They got on it right away, and they gave us all the bad news early. But a lot of places are still uncertain. People don't know if they're going to have jobs. And so you add that to all these other things. So what you have is these rolling effects. Now, what I've seen in my work is typically the anxiety comes first, and then your body can only stay nervous and hypervigilant for so long. So there's kind of a collapse, and the depression follows close behind. What's been rough about COVID-19 is that it's one crisis after another, bam, 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 bam. And so it's this reoccurring, these reoccurring painful episodes. And those are what we're going to have to manage. Can I give one more thing, and I promise I'll shut up? One more thing, I'm sorry, because I know you didn't all come here to see me, but one more thing I wanted from the management side of it. In a way, don't think of this as one crisis. Think of it as a bundle of things that are happening in sequence, well, sometimes in parallel. But the other problem is, what do I tell managers when I'm brought in? I say, well, you've got to have a close working relationship, because when you're close to people and you see them often and there's a level of trust, then you can anticipate when something's wrong, when there's a change in behavior, and provide the support people need. And what you see, of course, is when people have support, they respond much better. The problem is we're all over Zoom right now, and we don't have that very rich day-to-day interaction that we usually have. So what we have, what the result is a very serious sequence of mini crises, maybe not even mini, and then a social distancing that makes it harder for us to provide the kind of support we'd like to.
So, Esther, building on what Russell has said, we're curious what it is you're seeing presenting in the clinic and the people you're talking to, and what kind of support is it that people need in this moment? To Russell's point, to what extent can we actually provide the kind of support that's useful?
That's a great question. And I just want to mention, because we are a confidential service, I can't really express what we're seeing at FSEP, but I can give a general idea of what is being seen in the country, and at least at CU, which is there's going to be anxiety, there's going to be depression. Maybe that's kind of an ongoing thing that's been happening for years, especially in the country. And like Russell was saying, there's so many different levels of complexity that we're working with. It seems like no matter where we turn, there's something that's going to be there that we might have to deal with or not. It's kind of a choice thing almost, but it doesn't feel like it. And going off of what Russell was also saying is to be able to have employers support and even push employees to seek help, to seek counseling, to seek support, to seek somebody or something that they can trust, so that there's somehow a safety net for employees. It's so important. And not only push, but also support that if an employee needs to take time off or needs to go see a counselor, that it's okay. And hopefully the culture at the university is changing in a way that to be able to be productive, we need to take care of the employees. And it's so important. So there's got to be a mind shift for sure, because there's so much change going on, and we cannot sit there and just say, well, this is how we've done it this whole time. Something has to change. There's glass breaking outside my window. I don't know what's going on. But yeah, so just noticing that if the outside is changing, the inside has to change as well. It's a system, and a system is kind of like a cell. So if one of the parts of the cell changes or dies out, then the other parts of the cell need to adapt to keep surviving. And that's something that we need to look for as a system as well.
So before I leave you, Esther, for Andrea's workforce perspective on this, I just want to clarify, I know you can't talk about the specifics of what you're seeing, but I would imagine that you're seeing things that are unique or different now than what you might see in 5-6 months ago when we were under what we consider to be a more normal circumstance. So could you maybe express a little bit of what that difference is for people, so we know what we're looking for when we see a colleague in distress or an employee?
For sure. Yeah, well, it's kind of hard to explain. I'm trying to put into words what I'm thinking here, and it's anxiety and worry and feeling nervous are important things that we need to feel as human beings, because there might be a possible threat that we need to deal with. So we're looking at safety, we're looking at trust, like Russell was saying earlier, and we're seeing pretty much the same. The only thing that has changed is the circumstances, but human beings have to deal with change all the time. If we think about the time when we were going to start our PhD or master's or any sort of changes that happen in our life that are a little more normal and expected, we feel that in our system. And we're feeling that in our system again. Our system doesn't know how to know, oh, this is a pandemic and this is me being afraid of a roller coaster ride. It's kind of the same thing is happening inside of us. I don't know if that kind of explains it. So we're dealing with fear of the unknown, of when is this going to happen. And we were talking about this earlier before you all joined us. It's kind of taking it day by day, because we don't know what tomorrow's going to hold for us. So it's kind of reeling it back in and seeing that, oh, I'm dealing with fear, I'm dealing with anxiety, and that's information. And then we get to choose what we do with that information.
Thank you. That's helpful clarification. And Andrea, I could see you nodding the entire time that Esther was talking, because, I think people don't necessarily know about Delta Dental of Colorado's response, but I know that when the pandemic first became clearly an issue and everyone started to transition to work from home and companies were putting out new policies and procedures, one of the things that Delta Dental of Colorado did right away was create some mental health processes that were new. And so I think people will really be interested to hear both what Delta Dental did and also why that was. How did you recognize that that was an important part? Because I've looked at a lot of companies, and Delta anticipated, in some ways, some things that other companies are still trying to catch up on.
I think, Russell talked about supervisors knowing their employees. And while we're 200 employees, we still have a good group of kind of smaller departments that know each other very well. And we were listening to the supervisor feedback immediately. At the time we all went into quarantine in March, we still had school happening, which we have employees from the executive to line level. We have positions that don't require a degree. Maybe we have individuals that are right out of high school or the GED program, working all the way up to someone who has a doctorate. So we have levels of education, levels of experience, multiple earning levels and potentials. And so we had to acknowledge some of those things were happening, that we wanted to first start really with those Maslow's hierarchy of needs, and what are the basic needs someone has in their life. If they're dealing with 3 or 4 kids that need to get online, do they have all the resources they need from Delta to do their work well? Do they have good internet connectivity? All the way to, do they have the resources to get food if their kids were getting food from the free and reduced lunch program, and now that's not available to them? How can we help facilitate that? So one of the things we did, we've always had an employee assistance fund, and it's been for things like a house fire, a medical emergency, some of those big things that may come up in life that you don't budget for. We expanded that to include things around the pandemic and expanded the dollar amount that we would provide overall. And so that's helped. We had a big response to that. At first, it's slowed down since then, because we experienced employees that had other family members lose their jobs and need to move in with them. So that adds to the burden of the family with resources and food and time. And so how do we help them with that? All the way to once we realized we had maybe met the needs there financially, how were we going to meet the needs, which is a mental component too, of feeling that safety and security. But then moving to how do we help employees, as you talked about, Esther, with that your brain doesn't know if it's on a roller coaster or it's in the middle of a pandemic worrying about an older parent. It's one and the same, and it's all fear, and it really raises the adrenaline and cortisol. How do we help lower that? So we purchased a system-wide subscription to the Calm app. Now, if you're a member of Kaiser, they offer that for free, but we were kind of ahead of the game on that. And we did a lot of sessions. We're big believers in change management at Delta Dental. All of our projects and programs go through change management in a very systematic way, and we're taking the same approach. So we did a lot of training on what is the Calm app, what can it do for you, all the way to demonstrating how the kids Thomas the Tank or Thomas the Train stuff can help your kids calm down, because it's that whole person, it's that whole family approach. So those are just a couple of the things we did, but we had to take a look at how our employees working through all of their needs and their concerns, and then looking at the leadership too, not just saying you're the leadership group, you should be able to suck it up and go about your day, but we also had to say, what do we need to provide to leaders so they can provide support to their employees? So we did some of that too.
So
can I just add one more thing? I'm sorry. When you were asking me about what we've seen differently at FSAP, there's something that did come up to my mind, and it's that some people have previous experiences of dealing with anxiety, and some people have never dealt with anxiety, and it's completely new. And they don't know what to do with this new anxiety, this new sensation that they're feeling in their bodies, and insomnia and other things, and the stress that this is causing. So that's a big difference, because we have people with previous anxiety and now people with new found anxiety.
Andrea, what are you seeing that's working really well? Are there some of the strategies that you guys have been able to evaluate already? Are there things you're already changing or revising?
We have added more communications, so that certainly helped. We used to do a newsletter twice a month that talked about all the things that were happening, new projects, new initiatives, messages from our CEO. We were doing daily updates. Now we've scaled back to once a week. And we are doing things that are very technical, like our systems conversion, all the way to things like asking, are you finding you're reading more? What resources do you need? The other thing that we're doing that's helpful that we've realized is a big tool, before the pandemic happened, we put in place a new intranet. We call our employees team members, and so it's called TMI, Team Member Information. Kind of kitschy, I know. But the TMI intranet platform has really helped us talk with each other. We'll put out cool things like show us your furry office helper, and we've had cats and dogs, and those little bits of getting to know employees at different levels. We had a contest where we would show how long is your hair getting. It sounds so simple, but it's really helped us connect. And then those things branched into what we call water cooler talks. Our training manager is a spitfire. She is really an extrovert and so much fun. And so she'll have like truth or dare moments. And of course, it's called clean truth or dare, but it's fun things like, I dare you to email this silly riddle to our CEO. And it's just trying to connect all layers of the organization and also just keep us connected together amongst the team. So that's helped out. I think one of the things we're starting to see is that maybe TMI, our intranets, has its slow days and busy days. I think people are getting really into their work again, which is good, but we want to see how we can pull people back into that factor. The other thing that we're dealing with at Delta Dental, which is unique in addition to the pandemic and talking about racial inequities at work, is we're moving offices. We've been in the same office for 25 years. To talk about change, we're moving offices in October. And we have people that say, I love working at home. This is my first experience of this. I don't really want to go to the new office. I don't care how cool you make it. I don't care about the fancy coffee. I don't want to go. And so how do we build that desire back up to get people back in to be collaborative when it's safe and appropriate? So we're working through all of that in our change management. It's added another layer of stress for some and excitement for others. It's something to look forward to.
Russell, I'm curious, how much of what Andrea is talking about do you think is applicable to other kinds of companies? Because a lot of it sounds like culture, and culture is very specific.
Certain things work better in some contexts than others, so that's definitely true. But it is specific, but you can change cultures, and cultures actually change more rapidly during periods of crisis. So while I think the things Andrea and her team are doing are great, and but if a company is not doing, or if they don't have a history of them, this would actually be a good time to start, because even if it's not being done. Right now, people are looking around and they're looking for solutions, and they're ready to try something new. So you could build this positive culture. The other thing is, it may not seem like it when we're in July and we've all been home for a couple of months, but this will end. And what are we going to be like when it's all over? And so these communication things that Andrea is building are these skills that Esther is helping, in her team, helping people develop. Those are things that are going to make us better once the crisis is over and we're all back to work. So I really like a lot of these things, and I think now would be a better time than ever to try them. One other thought, I do this all the time. I tend to be, Esther was talking, I tend to be one of these people who've dealt with anxiety. So in crises, I'm actually happy because the world just finally caught up to what I always expected it to be. But I'm kidding, but well, half kidding. But one of the things I think that's important is if you think about your life and the times when you've really, really learned something and you've really become a better person, I bet you there'll be a lot of good times, like perhaps a grandparent, that was a good example. But there'll also be some bad ones, some times where you had to adapt to a tough situation. So that's what we're in now. And everybody is not getting worse because of this. I'll give you an example. last spring, some colleagues and I were collecting CEOs' statements to their stockholders and coding them for social responsibility. And then a pandemic hits and everybody goes home, so we keep coding. And what we found is that for many CEOs of Fortune 500 companies, they seem to be talking more about social responsibility after the crisis hit than they were before the crisis. And we have some theories for why that is. But the bottom line is at least many of our business leaders are beginning to think more holistically about the business environment. And so that's something that we can do better, that we can work together on. And so there's a lot to be worried about, but there's also a little bit at least to be optimistic about.
And I'll add to that, Justine, sorry if I could. I think it also adds to the mental health of our team members, our employees. When we say things like we're going to give $30,000 out to the community at food banks and shelters, and that seems like a natural for us because we've always given to charitable organizations. We took it a step further. It's been a learning experience for our leaders in what corporate social responsibility can be, because we've been giving premium breaks. We've been giving rate increase freezes. So we didn't do any of the rate increases that the Department of Insurance authorized us to do for an upcoming renewal. We just said, we're not going to raise your rates this year. We're going to keep them the same. We've been helping brokers out because they would have then lost a little bit of profit in the in-between if we hadn't increased those rates. We said, we're going to make up for it, that loss you would have experienced the revenue. It seems very business and very technical, but what our employees that interact with those brokers, those clients who are in the call center, who are talking with dentists and hygienists, they have an easier time talking about how our business is functioning, because they know they work for a company that stands up and says, we're going to take care of our employees and our dentists, our hygienists, the brokers, the clients. Everyone across the board is important. And that, I think, has helped our team understand they work for a nonprofit insurance company that just doesn't give to charity. We take it a step further, and that has certainly helped. To Russell's point, our leaders are now seeing this is the value of that business impact, that social impact.
So I'm curious, and I think a lot of people in this room, because we all work for somebody and with other people. If you wanted to initiate this conversation in your company, any one of you can really respond to this, but do you think you go to the management suite? Do you go to the HR department? Do you go to the CSR department? I'm curious where you think this conversation lives in the organization.
I think it lives throughout the whole organization. Our employee assistance fund comes from HR, but CSR played a hand in it. I sit in those meetings with the brokers, representatives, our client services, our sales, and at first they were like, why is she in this room? Because it's a collaborative social impact initiative and project. And some things I'm not involved in corporate social responsibility, and it happens at the C-suite. So I think it can't just happen in one department, because then that communication, talk about that, our marketing team was busy every single week with something new that we were launching. So they're key in being a part of the conversation. It's everybody, in my opinion.
I agree. I think that we're not only employees, but we're also human beings, and we have feelings and things are happening. And if we have the chance to have these conversations, then we feel like we might belong. And it's so important to feel like we belong somewhere, that we belong to people, that we belong to a system. And if we start from the bottom, I don't like to talk about a hierarchy, but it's kind of how it is here. If we start having these conversations on the bottom, then that can create some sort of a spiral all the way to the top. And it's, I mentioned this in one of my big team meetings, that we're all kind of like drops of water. And then this is probably a terrible example, but there's a torture method of drops of water falling on someone's head. And we can be those drops of water and continue on having these conversations to be able to create a change. So just like Andrea was saying, it's happening, it's already happening, and it should continue to happen on all different levels.
I would like to add on that. Hi, my name is Namrata, and I support the Sky Club at CU Boulder, and which is based on stress management, breathing techniques, and connection, diversity, and inclusion. And also, I've worked as a software professional for over 12 years. So I have, as part of I represent the International Association for Human Values, which is a nonprofit and does educational programs in this field. So I remember, like in the corporate companies, we approach the HR and also the health and wellness department. And then actually the first connection is with some senior management, my direct manager or some senior manager. And because they trust you and they are more open to bring programs or, for the team's well-being. So I've conducted 1-hour sessions for meditation and breathing and just workplace stress. And at present, there is a lot of anxiety among people, even if their companies, the software companies are doing pretty well at this time because it's all online. And, but still there is a fear of losing the job. So there is a lot of anxiety and about the uncertainty. And at this time, the companies are giving really high importance to bring mental well-being sessions and do anything for the employees. And with online programs, now the sphere is wider, because earlier it was localized to the office, but the companies are working with offshore and in different time zones from east to west coast. So they extend it and offer the, some sessions if whatever they feel the employee may benefit to everyone. So everyone is totally feeling the need of mental health. Yeah.
Thank you for sharing that. That's a great example. And I think it is a silver lining, if there is any, that in some ways we can be more connected than we would be if we were in an in-person environment right now. But it raises a question, Esther, about the effectiveness of telehealth and some of the kinds of things that Andrea's talking about and Russell's talking about really rely on a deep knowledge of the people that you're working with and that you're serving, that the mental health services are meant to help. And I'm really curious about how do you continue to get that information, and how do you stay connected with people effectively this way?
I was struggling with the idea of telehealth because I'm a very hands-on sort of counselor. I'm not an art therapist at all, but I use a lot of art. I use meditation. I use mindfulness in my sessions. And I was trying to think, how am I gonna make this happen? And it's human beings are so creative if we give ourselves the chance to be creative. And I've managed to make it work, and my colleagues and I see that we're still doing the work. And for some people, it's even easier to do it through a screen than to come in, than have to drive or walk or take public transportation to get to our offices. They can just be, if they're working, I see somebody did this, yes. I see that some people are more readily available and excited to do it from the comfort of their home or their car, or as they're walking in the park. We ask that it be private, but some people don't have privacy in their homes. So for some people, it's been a great experience. And as counselors at the Faculty and Staff Assistance Program, we've been able to adapt to telehealth, and it seems to be working. And we had a kind of a pause in how many people were reaching out to us, but we're back at full speed now. We're pretty busy now. So I guess that's pretty good that we can offer that support, because just stopping any sort of mental health support would be awful. So we managed to make it work very quickly.
Yeah, like thanks for adding that, Esther. Like, I just wanted to like quickly mention that, like, so when we talk about like mental health, so like we should like also talk about like accessibility, like to actual like pathological medicine, or like just like medical services and the complexities involved like with insurance, like that I feel like sometimes is also a huge factor like toward like mental health, or like stress like related like stress like related to actually like taking medication, or like seeking like medical like services. Like that lack of accessibility like sometimes like can add to the mental health like stress of people in general. And so there comes the factors of like lack of like public transportation, or like the hesitation of like traveling, yeah, in a pandemic, all those things as well.
Or even seeing somebody in person.
Yeah.
Some people prefer, and this is just across the board, some people prefer not to have their video on and just have a conversation on the phone. And that helps release some sort of anxiety that they might have felt to be in person or even through a video.
So is the emotional response and the need for services more magnified for some groups than others? Are there certain segments of the population? I know Russell talked about caring for an elderly parent and being in the sandwich generation. I'm in that generation too. But also there are, I guess, the portions of the workforce that are not the mainstream. And so I'm thinking also about how you craft policies that are broadly available to employees that have disabilities, have an LGBTQIA identity, come from different economic backgrounds, or communities of color. Which populations are the most vulnerable in this, and how do we craft policies that can meet the range of needs in the workforce?
I know a little bit about the different groups. I don't know a whole lot about how do you target the policies, but in terms of COVID-19, pretty much anything we say, right? We're still learning about how the pandemic is unfolding. So I'll try not to overstate the evidence that we have, but there are some things that we do know so far. So there's very big ethnic differences in how profound this pandemic has hit. Whites have done somewhat better, although I hate to use the term better about a disease. Maybe less bad would be a better way to say it. For Native Americans and African Americans compared to whites, you're looking at rates 4 to 5 times as high. So it's been really tough, like on some of the tribal nations and whatnot. They've had pretty serious consequences. Latinos a little less, but still quite a bit higher. In terms of LGBTQ, surprisingly, we didn't do a good job of collecting data. I know Pennsylvania started collecting that data about a month ago, something like that. And I think California is collecting it now. So I haven't seen good evidence on that yet, but I'd like to, and I'm sure I will, or we will, as this unfolds. In terms of gender, it actually hits the guys a little harder than the women. Part of that tends to be because women are better about managing their health care than men, and that's true across a whole number of ailments, not just COVID-19. There is some other evidence that's a little bit more questionable, but it's possible that XX chromosomes give you a little higher resistance to certain kinds of infectious diseases, and that's just in our evolution, and that's possible as well. And of course, it hits older people harder than young people. So the survival rate for young people is much better. So if you look I think a little bit over 40% of the deaths in the U.S. have been in retirement homes, in those kinds of things. So the level of the impact is quite a bit worse than the disease. But remember the secondary consequences, right, that we already talked about. One of the reasons different groups suffer from it more is access to health care or the quality of the job. So for example, Native Americans, poor people in general of any race, they're more likely to need to rely on mass transit. And they're often, they can't put grandma in a retirement home for both cultural but also for economic reasons. They might have multi-generational households. And those can also be problematic in terms of containing the disease. And so there's a number of things. I think the best response would be targeted to the different groups, and that takes into account their backgrounds and their unique needs. But our learning on that is still coming, and I don't have good answers, at least.
Something that we've done at FSAP, and I try not to get into fights with people because I'm very passionate about being inclusive and equitable. And for the past year, I've been working on our referral list to be able to provide services for all sorts of different human beings that we work with. And for too long, I had a separate referral list for Black employees. And the difficulty there was that I was getting pushback from some folks of how are we going to do the language around this? Are we going to say Black? Are we going to say people of color? What's a politically correct way? So I had a different set of referral lists. And as soon as Black Lives Matter started to be alive again, I said, I know you're recording, I'm sorry, but I said, fuck it, this has to be in the referral list. We can't keep wasting time trying to be politically correct, because then that takes us away from helping people who need the help. So that's kind of what we've been doing at FSAP. And also in terms of being inclusive, we don't want to say, well, if you are explicitly a racist, we're not going to work with you. But we're trying to kind of have some sort of language and saying that everyone is welcome, no matter what you think, no matter what your background is. If you need help, we want to be able to offer that support, no matter what you think that's right.
And Andrea, is Delta Dent doing anything specifically either in communicating with different kinds of employees about what services are available to make sure that they're accessible and visible to the people who might need them, or even tailoring services to different kinds of employees?
I wouldn't say that we're doing it more so for the employee group, but we're definitely reaching out to the federally qualified health centers. We've always had a great program of referring team members that may need those services at that level for a variety of reasons, financial, access to care. It hasn't come up to talk about services and reference people to different groups. It just, for our employees anyway, but for our clients, as we experience, they're talking about in Colorado, I think it's the last statistic I read, it was something like a 200,000 person increase into Medicaid, what that might look like. And we're trying to work through it when we who's coming on and off of our insurance program. It's a big factor. So how do we train employees to talk to providers and clients in a way to help them find the resources they need?
So I want to remind our audience to put questions in the chat if you have any that are coming up. I wanted to ask our three panelists, obviously, having high levels of anxiety can interfere with your focus. It can interfere with your relationships. It can interfere with your ability to get your job done. But how would you advise somebody to help make the case in their organization to be crafting mental health support supportive policies in this moment, what would you say is the one thing that they should take to upper management to get this done?
I think, again, working for a nonprofit insurance company, we have a lot of heart. So there's a little bit of a factor there that skews our leadership in many ways, but we still need to make a profit to then put it out to the community through our foundation and CSR efforts. So return on investment and productivity. We had a lot of questions of, will certain groups, when they work from home, actually work from home? Will they get anything done? Well, we had a drop in productivity because dental offices just shut down. So we then had to find other work, other trainings. It was a good time to get people up into the training modules they hadn't had time for. But there was a lot of doubt around that. And we had to just talk about recruitment, retention, return on investment. Just speak that business language. And mental health resources are completely tied to it. A healthier workforce, mentally and physically, they're going to stick around, they're going to be happier, and they're going to be more productive. I would say using that, all the research that shows how that helps with those things, the ROI.
Can I do the good one? If I had to pick one thing, and I don't have any particular reason for this, except it's the thing that sort of keeps me up at night. And I can tell you what I worry about. In times of crises, people tend to gravitate toward authoritarian leaders. And that's all across the world, to greater or lesser extent, people do that. And so what I worry about is leaders will use this, organizational leaders will use this as an opportunity, maybe not even consciously, because people at least temporarily want this, to stamp out programs that I think are very, very important. So worker empowerment, for example, self-managed work teams, anything like that that empowers people. So I think if I had to take one thing to management right now, and I would say better leadership, or maybe leadership for post-crisis. And so if you've got to be doing something right now as a manager, as an organizational leader, you should be laying the groundwork for more involvement, getting people to communicate better laterally with each other, to take more responsibility for things in their communities and in their organizations. So what I would say is resist that impulse for autocratic leadership and use this time of crises for a massive empowerment effort, basically. And if you do that, because solutions come from people, right? If you do that, you're going to survive this crisis better, and I think you'll survive the next one better as well. Mm-hmm.
I would just add that having leadership go through trainings to be able to understand, because a lot of trainings are offered for staff and faculty, and I'm always curious. I always try to look around and I'm like, well, where's the leadership when it comes to diversity trainings, when it comes to crucial conversations, when it comes to all these different trainings that staff and faculty are taking, that is also so important that leadership take as well.
Amazing. I have a couple of questions in the chat I'd like to read. The first one comes from Donnie, and it's for you, Esther. She says, loved what you said about action needing to be taken now. Could you speak a little bit about what meditation resources you have been using, and has it been effective?
Well, I graduated from Naropa University as a mental health counselor with a mindfulness-based track. So I can't really explain what sort of resources I'm using, but it's very much in the moment, doing it, going through it with my clients. And then they take a few of those things on with them. And then sometimes they come back and they ask me, well, can we do it again? And again, can we start our sessions with meditation or with the mindfulness practices? And it seems like it's very helpful because it gives their nervous system, and I'm sure you might know this, that it gives the nervous system some sort of relief to be able to it's kind of like a reboot, to be able to approach life from a different perspective other than anxiety. So that's my short answer.
Okay, and then this question, and I apologize if I don't pronounce your name right, comes from Shabankar. Did I get it okay? Pretty good, okay, thank you. When you talk about providing access to resources, do you think that there are, dare I say, too many resources and too many steps to reach to actually get a hold of a healthcare provider? Can certain groups find themselves lost in the bureaucracy of the healthcare system currently in place? Any thoughts?
I would say from the corporate perspective, yes. I think you can have too many hoops. I think our system is also, healthcare system is very reactive. And so it's also trying to figure out how to cope in this environment when you freeze elective surgeries and normal appointments and procedures. And even to go to Esther's point, talking about telehealth, your normal visit to your mental health practitioner becomes a phone or video, and just making those adjustments makes the system have to figure it out, and it lags behind the need of the clients that really need the help, the patients. And I think that creates more hoops at this time when we all just need the immediate pick up the phone. You know, I'm a Kaiser. I love Kaiser. That's what we have at Delta. I think it's very easy. I've had other systems that are easy as well. I've had some frustrations in just finding when you click on the app and going, I just want to find a mental health practitioner. It only talks about COVID and emergencies for the immediate need. But here's a phone number that you can call during the day. So those are some of the things that I don't know that it's inherently someone trying to divert people from seeking those services. It's just the system that they're in. And I think that's causing us a little bit of heartache right now.
Mm-hmm. Yeah, you know, that was a two-part question, right? Are there too many resources, or are they too difficult to access? And I liked Andrea's answer because it can be a pain. In a crisis, I always advocate sort of just acting and apologizing later, just saying the anxiety got to you and you couldn't help yourself. But I'm kidding. But I think the other question is, are there too many resources? Are there too many resources? And I think you got to be really careful how we've got to be really careful how we answer that question, right? Too many resources for whom? And some groups have pretty good access to resources, and some groups have far less access to resources. So for example, if you're under 65 in the United States, your health care likely comes from your employer. What if you just lost your job? Then you don't have access to the things you need. So I think while there's some groups that, although it can be terribly bureaucratic, while there's some groups that can get the resources they need, can get the health care, other groups cannot. So poor people, working people, that sort of thing. And I think that's important. The other thing to watch is the availability of resources for all of us. It could vary with the number of infections. So if you look, for example, at Houston right now, and perhaps parts of Florida as well, when you add people who are already in the hospital to the new cases due to the pandemic, you're seeing those resources strained somewhat. So at the moment, I think resources are pretty good in most of the United States for many people, but there's some people that chronically aren't getting the support they need, both mental health support as well as hospitalization and healthcare.
I would add that asking questions would be the way to go, because there is so much out there, and there are so many hoops, but there's people out there that are trained in that's their job, to help you navigate how to manage the system, because it is very complicated. For some reason, human beings want to make things complicated. I don't know why, but it is complicated, and there are people out there who can help out for sure. There's medical health plan brokers out there, so it's kind of like, but then it's, who do I trust? And it depends on the identity of the person. am I going to trust this person? I'm thinking about trans patients and how, I know we have 2 minutes left, just how trans patients are being pushed back because of what's happening in terms of politics. So there's always going to be someone to help, and we got to look at that for sure, not forgetting that those people exist.
Yeah,
That was a great question. Yeah, go ahead. You have a follow-up.
oh yeah, thank you for answering the questions I was saying.
Okay. Well, as Esther said, we have just a minute left. And I wanted to just read something that I read in a blog on Haystack. And if you're not familiar with Haystack, it's the Humanities, Arts, Science, and Technology Alliance and Collaboratory. And they had their blog in May. There was a woman named Kathy Davidson that wrote about the single most essential requirement in designing a fall online course. So she was talking about students, but it really resonated for me, for all of us, in any kind of environment in which we're working together and learning. So I believe the workplace counts. And she wrote, "We need to think about what we can all offer one another: curiosity, imagination, knowledge, power, as antidotes to the present disruption and trauma, as tools towards building a future." I thought that was a beautiful way to think about how we can be colleagues and managers and employees in our work lives, and relevant also for our home lives. With that, we are out of time. Oh, Andrea, did you have something you want to say?
No.
Okay.
Just want to say thank you for the invitation. Thank you for having us today. Yeah.
Well, thank you. I learned a lot from listening to this conversation. I am putting in the chat a link to a brief feedback form, and I will also send an email out to everyone who participated today with this link as well. But if you have time to give us some of your thoughts on today's panel, that will help us shaping future topics and structures. So thank you all very much for joining us, and I hope you have a wonderful afternoon.